I want to introduce our speaker today, Dr. Maureen Murray. And it is really my pleasure to have her here. She is going to be an awesome speaker, and this topic is really a very interesting one. Dr. Murray is the wildlife disease ecologist at Lincoln Park Zoo's Urban Wildlife Institute. In her research, she uses a One Health approach to understand sustainable strategies for mitigating human-wildlife conflicts in urban ecosystems. She uses interdisciplinary approaches combining human dimensions, animal behavior, wildlife health, and landscape ecology to study species ranging from rats to grizzly bears. And with that, I give you Dr. Murray.
Thank you so much for that introduction, Deb, and thanks for everyone attending. I'm very excited to chat about rats with you all, and it's great to learn more about the One Health Initiative. This is a really great program. As I'll get into in my talk, we are starting to use more of a One Health approach at Lincoln Park Zoo's Urban Wildlife Institute, and so love to hear more about the program in the question period. Okay, great. So a little bit about my background. I feel like when you're doing interdisciplinary work, it's really helpful to give, your individual history and perspective what you're bringing to this project. So I am a wildlife ecologist by training that turned into a wildlife disease ecologist over my grad school work and postdoctoral work. So I did my PhD on urban coyote ecology at the University of Alberta with Colleen Cassidy St. Clair. And that really got into coyote parasite dynamics, and that got me really excited about wildlife disease and how disease can affect human-wildlife interactions in cities. And so then I went on to do a postdoc at the University of Georgia with Dr. Sonia Hernandez on urban white ibis ecology and health, specifically how feeding ibises in urban parks can change salmonella dynamics in those populations. And then I started at Lincoln Park Zoo as a wildlife disease ecologist in 2017. And since starting at the zoo, I've tended to stick with mammals and birds so far, but those include a wide range, including songbirds, small mammals, coyotes, and Canada geese. So at the Urban Wildlife Institute, we are a small group. There's only about 8 of us, but we are an innovative group in sort of this non-traditional research setting. And it allows us a lot of flexibility to do long-term monitoring and to do a lot of public engagement about urban wildlife with the overall goal of promoting urban biodiversity and preventing human-wildlife conflict. And I bold and italicize that because that really comes into play when you're talking about rats. Absolutely. And I highlight a few pictures here just to showcase the other work that we do. I'm going to talk mostly about rats today, but we don't only study rats, of course. So one of our ongoing monitoring projects is looking at tick populations in Chicago green spaces, doing tick drags over the spring, summer, and fall over multiple years to look at human exposure risk in different types of urban settings. We also have over 100 camera traps throughout Chicagoland, and we've been doing camera trap monitoring for over a decade now to look at mammal communities over the urban gradient. And of course, there's very interesting overlap with the tick monitoring and mammal hosts. And then the picture on the right there in the bottom is acoustic monitoring for bat populations in Chicago. And we've done a little bit of work on bat stress over the urban gradient. But today, as I mentioned, I'm going to be talking about the Chicago Rat Project that I started back in 2018. And you might be thinking to yourself, okay, so you've studied quite a few species by now. Why invest? Why go all in on maybe the grossest one? And it's true that urban rats aren't necessarily the most glamorous study species, but they are incredibly fascinating if you're interested in human-wildlife interactions like I am. Because rats, they live in very close proximity to people. They enter our homes and our businesses. They're actually one of the species with the broadest geographic range on Earth. This map is showing the range of the brown rat, otherwise known as the Norway rat. And they actually inhabit every continent except for Antarctica. So in terms of generalizable issues, virtually every city on Earth is dealing with brown rat infestations in one way or another. And lastly, rats cause billions of dollars in property damage They can chew through a variety of materials to get into homes. They cause billions of dollars in damages, as well as threats to public health. Okay, so why are rats so successful in cities? They're perhaps the most successful species on Earth if you're thinking about vertebrates. And that's because they have an incredibly diverse diet. They can eat anything that humans eat, and so they really benefit from food waste and garbage in cities. And they also reproduce extremely quickly. Two rats, given the right conditions, if they, they have enough food, enough resources, they can turn into 1,200 rats in the span of a year. And so when you're trying to manage rats in cities, it is a continuous problem and not sort of a check it off your list that you manage your rats. It's a continuous problem that keeps coming up. In terms of excluding rats, it's also very challenging because rats have collapsible rib cages, and so they're able to fit in very small spaces. And they also have extremely sharp teeth. On sort of what's known as the diamond hardness scale, rat teeth score well above human teeth, and they can chew through metal pipes, they can chew through PVC, they can chew through brick, they can chew through concrete. So excluding rats from homes is incredibly challenging. And I mentioned public health risks. I mean, I'm probably preaching to the choir here. This might be sort of common knowledge by now, but having rats around, not great for public health for a variety of reasons. I focus on pathogens that are transmitted through the environment, through environmental contamination, namely through feces and urine. And a notable pathogen that rats carry of public health concern is Leptospira interrogans. That is the bacteria that causes leptospirosis. And it's transmitted through rat urine. And so in cities where you have puddles and other sources of standing water, these could be sites of transmission between rats and humans or rats and domestic dogs. And while leptospirosis is much more common in the global south than, say, in cities in the United States, it is present. And a couple of years ago, there was a bad infestation in an apartment building in the Bronx. A few people contracted leptospirosis and one of them died. So it is a rare event, but it is something to keep on the radar. In terms of foodborne pathogens, rat can carry several. I focus on Salmonella and E. coli, not necessarily because rats are important reservoirs, but because they live in quite unsanitary conditions. And so they can act as sort of a physical vector to move these bacteria from, say, sewers to dumpsters to kitchens, things like that. Oh, and I should mention before I move on, I'm going to come back to these pathogens later. So I mentioned that rats aren't necessarily an important reservoir for those foodborne pathogens, but they are an important reservoir for leptospirosis in that they are thought to be asymptomatic and lifelong carriers. And I promise that's relevant. Okay, so to manage these risks from rats in cities, we want to be able to predict where risk is highest. And there's been surprisingly few studies on rats in cities. Those that have been done have found things like areas with lower incomes have higher rat populations, places with vacant housing are more likely to be infested. But these studies have typically focused on areas that are already thought to be quite rat infested, for instance, low income neighborhoods or, say, neighborhoods adjacent to ports, things like that. And they tend to focus on small spatial scales. So understanding rat dynamics across an entire city, that is fairly lacking at this stage. And in Chicago, what better place to study rat dynamics across the city, because we are thought to be the rattiest city in the United States. We were declared the rattiest city for the 8th consecutive year recently by Orkin. So hats off to us, I guess. I don't really think that's ecologically accurate because nobody really knows how many rats live in a city. Basically, these are going by pest management calls and public complaints. So I like to say that we're like the national capital in complaining about rats. In 2021, Chicagoans made over 60,000 rat complaints, which is over double New York City. And well, I'm not going to get necessarily into the reasons between cities in this talk. I do want to highlight here this photo on the right is sort of a typical Chicago alley where folks can lodge complaints about rats. The city comes out and baits their alley, puts up this poster notifying people that they've come, when they've come, and how many times they've come. So just to give you some background on how rats are managed in Chicago. Now, an additional layer that we investigate in the rat project is that Chicago has notorious disparities across the city in socioeconomics, investment, that are strongly correlated to racial and ethnic minorities. And so here's a couple of figures just showing this change over time, or you can see in 2017, sort of the economic inequality between the relatively affluent northeast side of the city, where you can see the dark blue color. Those neighborhoods are typically majority white, high education, high income, compared to the south and the west sides. They're in the sort of bright red, which are lower income, lower investment, majority Hispanic and brown communities and Black communities. And so that's a strong component of this project to understand how these disparities might translate into vulnerability to rats. And so the overall goal of the Chicago Rat Project is simply just to learn more about Chicago's rats, to prevent health risks and improve rat management. And we approach this in two ways. We do disease ecology studies on rat populations to figure out what pathogens they are carrying and how we can predict those infection dynamics. But then we also talk to people using surveys and interviews to understand human experiences with rats, because ultimately humans are an important part of this picture and we need to understand those interactions. Okay, so overall research questions for the project are simply what promotes rat infestations and what promotes rat infection with zoonotic pathogens. And from talking with people, we can also answer questions like, how frequently are people encountering rats? What sort of health risks are present for these populations? Are people facing any barriers to rodent control, financial or otherwise? And which residents are more vulnerable to rats based on either their experiences, where they live in the city, or barriers and capacity for rodent control? And of course, we're using a One Health approach to study rats. I mean, I'm not going to preach about all the benefits of a One Health approach to y'all, but of course, especially when you're thinking about something like rats, it is impossible to separate the dynamics going on with rat populations to risks for humans and how humans are influencing the environment. So it's a really great system to take a One Health approach. So I'm first going to start with sort of the wildlife health part of One Health and look at rat pathogen dynamics. And so to gather data about rat pathogens throughout the city, we have partnered with pest management companies, namely Landmark Pest Management, who agreed to trap rats across an income gradient in Chicago so we can understand which communities may be more at risk in terms of rat pathogens. And so I've highlighted those community areas here on this map of Chicago, and they are colored by income. So you can see this income gradient with the purple circles representing our trapping alleys. Once we had the rats from Landmark Pest Management, we conducted full necropsies, including morphometrics and condition. We collected kidney samples for leptospira, and we collected their low intestine for bacterial culture of those foodborne pathogens that I mentioned earlier, namely Salmonella and E. coli. And we did this work in partnership with the Field Museum. That's a large natural history museum in Chicago, who realized that they only had like 5 rats in their collection or something from Chicago. And so they are quite excited now to build up that collection to understand population genetics in Chicago's rats. And so during this initial trapping phase, we trapped over 250 rats and necropsied over 200 rats. We found that 5% had leptospira and over 20% had E. coli. And so we focused on those 2 pathogens. And when we looked at prevalence of those 2 pathogens over different community areas, we found that there was high heterogeneity here. There were some neighborhoods, like you can see in the far north, where there wasn't many positive cases of either pathogen. But then there were some neighborhoods throughout the city that had a higher pathogen of both. And so we wanted to investigate on a finer scale what spatial predictors might exist to understand why these pathogens are higher in certain areas. And so we zeroed in on sanitation as a factor that affects, rat abundance, but also perhaps transmission of pathogens. So at each of our trapping alleys, we laid down a 150-meter buffer because rats are thought to not really move beyond the boundaries of a city block. And we looked at standing water complaints made to the city as an indicator of where leptospira might be transmitted through the environment in rat urine. And we also looked at food inspections as a measure of how many restaurants are in the area. And we wanted to focus on restaurants as a likely source of food waste that might promote the spread of foodborne bacteria. And so first I'm going to talk about E. coli. And we found that rats trapped on blocks with more food inspections, so more restaurants, they were more likely to carry E. coli bacteria. But they were especially likely to do so in lower income neighborhoods. And so I don't fully know the mechanism tying sanitation to socioeconomics in this case, but we might surmise that restaurants in lower income areas might have reduced capacity for pest control or other sanitary measures. And so these might be areas with higher need for sort of targeted surveillance. On the flip side, when we looked at leptospirosis, as expected, we found that blocks with more standing water complaints were more likely to be inhabited by rats infected with leptospira bacteria. But this was especially true in neighborhoods with higher incomes. And so again, mechanistically, this is a little bit harder to tease apart. Part of it might be that there are a lot of historic properties in Chicago's more affluent neighborhoods. So this might be a function of sort of age of infrastructure and something that we can look into in future. But the real takeaway here is that if you don't study rat pathogens or zoonotic pathogens in general across different areas of the city, you're going to be missing pretty important patterns with socioeconomics that you would miss if you only just zeroed in on low income areas and didn't even bother doing surveillance in higher income areas. Oh, sorry, last point is that I also really like this result because it emphasizes that rats and their associated pathogens are really everyone's issue. A lot of people talk about rats as sort of like a quote unquote poor person's issue, but that could be farther from the truth, especially in Chicago where there are rat complaints everywhere and health risks might be even higher in higher income areas. Okay, so looking at human exposures relevant to public health, we realized that, this was early days in the project. We really focused on rats and their pathogens, but we thought, we're really missing half the picture because as I mentioned, humans are an incredibly important component of rat dynamics. We're the reason they're so successful in cities. And we ultimately dictate, where they're going to persist and where they're promoted based on things like waste management and rodent control. So we wanted to understand how rat infestations affected people, specifically in the context of their experiences, their attitudes about rats and wildlife, and their health outcomes. And we also thought, well, isn't this a fascinating case of a coupled human natural system where rats affect humans in terms of their health outcomes and experiences, but of course humans also affect rats in terms of where rodent control is implemented, what methods are people engaging with, and how this might affect other wildlife, such as carnivores. So I will get to that later, but currently we're going to focus on people. And we were all excited to get into this coupled human natural system. We got a 3-year NSF grant to study sort of how rats affect people, how people affect rats. And then of course the pandemic hit in 2020. That's like literally when we got this grant. And so at first, I was frustrated. We were all getting ready to start collecting data and of course field work was put on hold and everything. But then we started watching the news and things started getting sort of interesting from a rat perspective. Rat complaints were shooting up in cities around the world. And it was hypothesized that when restaurants closed during the early stages of the pandemic, this sort of shifted where garbage was available on the landscape. Instead of, restaurants having dumpsters full of food all the time, all of a sudden those dumpsters were empty and the dumpsters near homes were much more full than usual because everyone was getting takeout and not going to restaurants. And so people were sort of surmising that, well, rats are sort of moving across the landscape. So we wanted to understand these dynamics. It got so bad that the CDC actually issued a statement on rodent control that additional rodent control might be necessary during the pandemic, during these shifts. And so that sort of really motivated us to look at this issue. Now, if you could think way back to March 2020, Of course, different cities experience this differently, but in Chicago, there was a stay-at-home order for about 2 months where residents were required to stay home except for essential needs, and non-essential businesses were closed, and there were no dine-in restaurants. And so we did this online survey during this period where people were staying at home. And we did an online survey since it was extremely time sensitive and sort of came out of nowhere. So, we wanted to pivot quickly with online methods. So we emailed the online survey to all aldermanic offices in Chicago and at least one community organization at least one community organization in each of Chicago's 77 community areas. And we asked about things like the frequency and change in folks' rat sightings, the encounters they're experiencing that are relevant to public health, any concerns they were having, and their engagement with rodent control. And we also asked about what neighborhood they live in and their closest intersection, so we could do some spatial analyses as well as demographics and housing. And we wanted to know their closest intersection so we could understand things like socioeconomics in their census tract, as well as their proximity to restaurants, to sort of test this idea that it was really restaurant closures driving these changes. And so we got over 800 responses to our online survey. Here's a map showing the spatial distribution of those responses. You can see that there's a pretty strong bias towards the northeast part of the city. As a reminder, that is sort of like the more affluent part of the city. So it's not shocking that we had more engagement there, but it did align fairly closely with where there are more rat complaints. So there might be multiple biases here. In terms of a change in rat sightings during the stay-at-home order, around 20% of people noticed an increase in rat sightings around their home or on their block. And so we wanted to understand who were more likely to see more rat sightings during this time. And so, as I said, the first thing we looked at was proximity to restaurants. And so this plot is showing the number of restaurants within 500 meters of the respondents' closest major intersection. And the y-axis here is the probability that they would give a certain response, either more rats, about the same amount of rats, less rats, or I don't even see any rats. And so the red line is the one that we're interested in. That is the probability that they observed more rats during the pandemic than usual. And you can see that there is a positive relationship here, and this relationship was significant, that respondents with more restaurants near their closest intersection were more likely to see more rats, supporting that idea that restaurant closures might be affecting things. We also found that respondents in small apartment buildings were more likely to see more rats. And this is interesting to us. We're always interested in sort of how housing affects rats, because of course homeowners can sort of bring about change on their property, but it's harder for apartment dwellers. So understanding that folks in small apartment buildings, maybe they're sort of at the mercy of how their neighbors are handling their rodent control. We also were interested, of course, in contacts that might result in public health risks. And we were sort of shocked. Our survey was really only available for that last month because we took time to get it together. And we were sort of shocked that in that 1 month, 263 people saw rat feces in their home. That was over 30% of respondents. Almost 80 people touched a rat in that 1 month span, and 4 people were bitten by a rat in that 1 month span. So that really encouraged us, we really need to get a better handle on what sort of exposures people are experiencing. We also did some qualitative work to understand sort of more descriptively what people were experiencing with rats in their day-to-day lives and how they were impacted by those experiences with rats. And so we simply just asked folks how their rat sightings made them feel. And it was really eye-opening, the diversity of responses we got to this open-ended question. We did a thematic analysis to understand sort of the major themes that people were bringing up, both a priori, like we kind of assumed that people would bring up emotional responses because we were asking how they felt. And people, perhaps not surprisingly, described feeling disgusted, afraid, that their house was unsanitary, that they felt unsafe, that they were very frustrated. But there were a number of emergent themes that we hadn't anticipated. For instance, many people brought up accountability and who's responsible for rats, that the members of their community attracted rats no matter what they did. They brought up being frustrated with their neighbors and particularly restaurants for attracting rats. A lot of people also brought up sort of the context of their rat encounters, that the timing had shifted or perhaps the location. Now they were seeing them more near their home, or rat behavior. For instance, people brought up rats being a lot less afraid of people during this period, and that really rats were being bolder during the pandemic than they were normally. And in terms of impacts on their day-to-day life, people brought up a variety of ways that they would change their behavior to avoid seeing rats. Things like they wouldn't use their patio anymore, they wouldn't use their yard anymore, they wouldn't go outside at night specifically because of rats, or they wouldn't allow their children to go outside and play because of rats in their yard. Other people mentioned financial burdens, such as spending money to avoid rats or control rats. For instance, having a severe infestation led to people not cooking in their kitchen anymore. And of course, that becomes very expensive over time. And the real salient point that was brought up during the pandemic specifically was how uncomfortable people were feeling about using their outdoor spaces. And of course, if you think way back to the spring of 2020, that was really all people had, right? Like you could watch TV or, maybe go in your yard and enjoy the spring, and they couldn't even do that. So it seemed to really impact people negatively during this time. So in terms of lessons learned from this specific point in time during the quarantine, we found that rats might respond quite quickly to changes in garbage availability, given that we saw that shift in who was seeing more rats near restaurants. We also learned that the impacts of rats are quite diverse, and there were a lot of unanticipated impacts that we learned from folks, specifically, being afraid of using their yard, as I mentioned. A number of people had car damage from rats. And I put up this bird feeder because that was something that really struck me as someone who studies, urban biodiversity, that a number of people stopped feeding birds or stopped gardening or stopped composting because of rats. And so that's a really interesting future project for us in terms of how people are engaging with nature or lack thereof because of rats. The third lesson we learned is that conflict is really a community issue. A number of people mentioned, like, I do everything I can, but I'm only one person. And so I'm very frustrated that my neighbors don't take it seriously, or that the city doesn't take it seriously, or that my alderman isn't listening to me. And so, really, we're not an island when it comes to rats. If your neighbor has lids off their garbage cans, that's going to affect you too. It's kind of the bottom line. Okay. So as much as we enjoyed learning about rats in this unique time, of course, this isn't hugely generalizable to times when we're not under a stay-at-home order. So we did the survey again last summer, and this was a more rigorous survey with multiple mailouts, randomly selected households in these neighborhoods, things like that. And so we targeted these 12 community areas here on this map, again, along that income gradient. You can see again from the shading on these neighborhoods that, again, we got more responses from the north side, a little bit more in the northwest, but the bias was a little bit better than with our online survey. We also offered this survey now in multiple languages, I think that which really helped. And I highlight this map again here on the right with the red and the blue zones of Chicago to sort of remind you of these inequities across the city and income and investment, and again, aligns closely with segregation between white neighborhoods, predominantly white neighborhoods, predominantly BIPOC neighborhoods, to sort of show where our neighborhoods line up, because this will be relevant later as we talk about the north side of the city contrasted with the west side and the south side. So the ultimate goal here, of course, is to identify communities that are a higher risk from rats than others. And of course, multiple components go into risk. You have, the rats themselves, whether people are actually seeing rats, but you also have exposures that are more concerning, such as direct physical contact with rats, and people's behaviors that might increase those contacts. And of course, we're interested in vulnerability as well. And that is a really multifaceted factor here. It could be someone's capacity to control rats, both in terms of finances, but also in terms of knowledge and their trust in management, whether they're even engaging in existing rodent control programs. And of course, we ask people about their children and pets, as these family members might be particularly vulnerable to pathogens since they spend more time on the ground. Okay, so in terms of socioeconomics and exposure, we found that exposure to rats really varied across the city. And here the columns in this chart indicate different sides of the city. So to remind you, the north side is the more affluent side of the city, contrasted with the south and the west sides. And this would align with sort of predictions that neighborhoods with lower socioeconomic indices see more rats, where the west side respondents were more likely to see rats around their home, and they were also more likely to see rat feces and smell rat urine in their home. So sort of across the board, the west side of the city had more exposure to rats. We wanted to make this a bit more generalizable. So instead of simply looking at what region of Chicago you lived in, we looked at reported income that the respondents provided in their survey. And we found that respondents with lower incomes were more likely to see rat feces and smell rat urine in their home than respondents with higher reported incomes. When we wanted to understand, maybe how knowledgeable people were about these risks, we asked them whether or not rats carried these 4 zoonotic pathogens, with leptospirosis and hantavirus being our 2 more common rat-associated diseases, and rabies and West Nile virus as zoonotic diseases they may have heard of before, but aren't actually really associated with rats. In fact, there have been no confirmed cases of a rabid rat. You would not know that based on the fact that 80% of our survey respondents thought that rats carried rabies. And in our interviews, multiple people brought up being very terrified that rats were going to sort of jump at them and bite them in the neck and give them rabies. Whereas they didn't seem all that concerned about the feces and urine in their house. And that might be because only 30% of survey respondents were aware that rats carried leptospirosis and hantavirus. So these are really sort of targeted areas where public outreach and public education might go a long way to help people understand why they should clean up feces and urine in their home. And in terms of understanding how to reduce exposure to rats, we asked about complaining about rats to the city when they saw them. And what we found was that only 35% of respondents actually reported the rats that they saw. So that's a lot lower than we expected, and points to a real mismatch between how the city manages rats, which is based on where people report their rat sightings and where people are experiencing issues with rats. And so we wanted to understand why people were more likely to complain than others. And we found that the strongest predictor was that people who agreed that their rat complaints are taken seriously were significantly more likely to complain about their rat sightings than people who didn't agree that their rat sightings are taken seriously. And so I wanted to understand if there was, any sort of spatial or socioeconomic predictors and who were more likely to think that their complaints are taken seriously. And we found that this divide between thinking that your complaints are taken seriously or not is much stronger in the west and the south sides compared to the north side. Here on the west side, you can see that nearly half of respondents did not think that their complaints were taken seriously, compared to less than 20% who did think that their complaints were taken seriously. So this is a real area for the city to, build trust with these communities so that they actually engage with the rodent programs that are existing. And this all goes towards supporting higher risk communities. We found that residents in the west side and particularly lower income residents have more exposure to rats. And sort of regardless of where you live, people need more education about diseases spread through rat feces and urine. And we really need to build up that confidence in the rat complaint system, particularly in communities where this trust has been eroded, such as the west side. And I highlight 2 headlines here. These are ones from 2022 and ones from 2021, so pretty recent cases where west side communities appear to be really strongly impacted. When I talk about rats to folks who haven't really experienced much issues, they're sort of like, isn't this kind of like a niche issue? But when you hear from a family who has to leave their home in February in Chicago because the rat infestation is so bad that they can't use their kitchen and they can't sleep at night, that is not a trivial issue anymore. That is coming up with the money to move suddenly. That's coming up with the money to eat takeout every night. That's coming up with the money to replace a lot of damaged items in your home. So for these communities, this can rank pretty darn high on their list of priorities. Okay, so to round out sort of the One Health system here, I want to touch on environmental health impacts of rat management. So again, we're thinking about rats and people as this coupled human and natural system. And we want to understand how rodent control affects rats in terms of disease risks, but also their predators and sort of the wider urban ecosystem. So as I mentioned, Chicago and really cities around the world primarily rely on rat poison to lower rat populations in cities. This is for a few reasons. It's touted as being sort of the most affordable. It's certainly more affordable than going out and physically trapping rats, because that just takes a lot more sort of person hours to do that. So far, this is sort of like the mainstay of municipal rodent management. And as many of you may be aware, rodent control certainly doesn't, or sorry, rat poison certainly doesn't stop at the rats themselves. First of all, other species can be exposed to rats simply by consuming the bait. Instead of rats consuming the bait, you might have a raccoon or a squirrel accessing that poison bait. But even once it's uptake into the target species, into the rats, then predators can be exposed to sort of secondary poisoning by consuming those poison rats. And this has been documented in a wide variety of species. Raptors, so predatory birds, tend to get hit the hardest. It often results in death for species like hawks, eagles, and owls. But mammalian predators like coyotes, bobcats, and mountain lions have found to be exposed at quite high rates. And a lot of this work's been done in California. So if you're interested in this, we can talk about it more. I can send you papers. So what's interesting to me as a disease ecologist is that even sublethal exposure to rat poisons in these predators can result in changes in likelihood of infection. And the hypothesized sort of route here is by immunosuppression. So this has been documented in bobcats and mountain lions, both in terms of notoedric mange, that cats that have been documented with rat poison circulating in their system are proportionally more likely to exhibit signs of notoedric mange. And there's been follow-up work that this is sort of based in terms of a mechanism based on immune function. So a lot of elevated or decreased immune function parameters in predators, but also in rats, actually. There's been very limited work, and it's super old now, but there was some work on rats exposed to warfarin exhibiting some of the same immune marker sort of dysfunction compared to these predators. So that made me wonder, could rats actually be more likely to be infected with zoonotic pathogens if they're exposed to rat poison but don't die? And there's been some work demonstrating that rats can survive up to 10 days following exposure to rat bait. And so there could be this window between being exposed to the rat poison and death, where rats might be at an elevated risk of zoonotic infection. And so we investigated that with Leptospira, with the rats that I mentioned at the beginning of the talk, trapped by pest management professionals. We found that 10% were exposed to rat poison in that time. And so we compared rodenticide exposed to non-rodenticide exposed rats in terms of E. coli and Leptospira infection. And we found that rats that had been exposed to rodenticide were over 3 times more likely to be infected with Leptospira, and this difference was significant. But we also looked at just demographic differences. We didn't find any sex differences in terms of infection prevalence, but in terms of age, we did find that adult rats were more likely to be infected compared to young adults and juveniles, which tracks with other literature that rats, since they're thought to be sort of asymptomatic lifelong carriers, the older the rat, the more likely they are to have picked it up along the way. And so again, the hypothesis being that perhaps sublethal exposure to rodenticide can result in immunomodulation because rats that have been exposed to warfarin exhibited increased lymphocytes, basophils, and monocytes, but suppressed neutrophils have been exhibited in carnivores. And So you might be wondering, well, what are the odds that they actually get infected in that very limited window? But there has been experimental work showing that rats exhibit signs of infection within 7 days of exposure. So it is theoretically possible that rats exposed and then consume the bait could become, infectious in that window. And so sort of the hypothesized mechanism here in this figure is that rats are exposed and then they have increased susceptibility for infection. Of course, it might go the other way. This was not an experiment. This was observational work. And so folks could surmise that maybe infected rats were more likely to consume the bait. There has been work in other species showing that diseased individuals are sort of more desperate for resources and consume sort of suboptimal resources compared to healthy individuals. But again, as I mentioned, rats are largely considered chronic asymptomatic carriers of leptospira. So that suggests to me that you wouldn't necessarily expect sort of large behavioral changes after they've become infected. And so regardless of direction, this sort of signals an unintended consequence of rat management for disease dynamics, where municipalities tend to deploy rat poison where there are rat infestations, leading, of course, to rats being exposed to rat poison, which has some positive association with leptospira infection, which then feeds back to human health, which was really the point of the rat poison in the first place. And so there are maybe important feedbacks with policy here where, the policy is intended to protect public health, but if rat poison has these unintended effects on infection dynamics, you might be setting up this unfortunate positive feedback loop. And so to break that loop, we really need to focus on other ways of managing rats that are more sustainable. So integrated pest management is this concept that you combine multiple approaches to managing rats. Sanitation being a huge one. I didn't really get into the details of this part of the study in this talk, but we did an early study looking at which alleys were more likely to have higher rat abundance. And we found that, alleys with piles of uncontained garbage were more likely to have higher numbers of rats. Kind of shocking, right? Not really that surprising, but some evidence-based recommendations for reducing rats based on availability of garbage. Now, of course, physical exclusion of rats from buildings is also quite important. And we're not going to get away with not removing any rats, but really it all kind of boils down to, at the end, changing human behavior so that we are reducing rat attractants. And so really the ultimate goal of this project is to provide information about people's issues with rats, to identify best management practices, prevent rat infestations, and reduce health risks and the need for rat poison. So prevention, of course, worth a pound of cure. In future, we want to expand into community gardens because from talking to folks, as I mentioned, people have issues with bird feeding, they have issues with gardening, they have issues with composting in terms of rats. And we've received a number of emails from community gardens in Chicago struggling with rat infestations. And there currently exists no research on rats in community gardens, so we're hoping to start that next year. And we are also currently investigating rodenticide exposure in mesomammals in Chicago. And this work's largely being led by Jackie Buckley, who has been collecting biological samples from raccoons, opossums, skunks, and feral cats to ascertain how often they are exposed to rat poison, and if there's any sort of spatial predictors, for instance, urbanization intensity, human density, location of cat colonies, things like that. And here I have a somewhat gruesome picture of a juvenile opossum, and you can see that their stomach contents are turquoise, indicating that that opossum directly ate bait intended for rats. And so there could be multiple exposure routes at play here, but for scavengers like raccoons and opossums and skunks, they might be directly attracted to the bait itself. And I just wanted to wrap up here. I do want to leave time for questions, of course, but I just quickly want to touch on a new focus we have here at Lincoln Park Zoo, which is One Health and Social Inequality. I just wanted to throw this figure up again, highlighting how much inequities factor into the rat project, both in terms of who's seeing rats or animals in general, who is exposed to rats that might be conveying health harms, and who is more vulnerable based on knowledge and capacity. And so I wanted to give a quick plug for a recent paper we published in Annual Reviews of Ecology, Evolution, and Systematics, highlighting how environmental justice can inform One Health work to understand health inequities based on income, race, disparities within the city based on things like heat, vector-borne disease, water quality, and air quality. So feel free to check it out. I was really excited. There was so much interest initially that the journal decided to make it open access, which is awesome. So everyone can hopefully access that. And this all feeds into sort of a new vision we have for disease work at the Urban Wildlife Institute, really focusing on One Health and equity, offering interdisciplinary internships, and focusing on multi-city research. I don't really have a chance to talk about it today, but we lead an initiative called the Urban Wildlife Information Network, which is a consortium of cities that collects data on urban wildlife using consistent methods. So we can look at things like mammal communities in multiple cities, or we're starting to get into tick communities in multiple cities. And so that's a real focus for us going forward. Okay, with that, I would like to thank the large interdisciplinary team on the Chicago Rat Project. If you would like to follow up with me after the talk, my email address is there, but I would be happy to take any questions.
Thank you so much, Dr. Murray. That was awesome.
Okay.
We have about 10 minutes left, so yeah, lots of time for Q&A. Does anyone have a question for Dr. Murray? You can put it in the chat, or you can go ahead and unmute yourself.
Looks like there are some chat. Oh, you're very welcome. Thank you. That's
So I think this is really amazing because it's not, I will admit that, to be honest with you, the restaurant closure and the rat issues, I was not actually aware of with COVID, but it makes total sense. And this is such an amazing study to look at, not just, I guess, kind of using this human rat interface, but as a model for a much larger issue. And I really love how you looked at the social injustice and aspect of it.
well, thank you. I appreciate that. Yeah. We tried to pivot quickly. Of course, there's like limitations to an online survey, but in retrospect, I'm glad that we had that opportunity to look into that issue, because there's also a lot of just misinformation going around then. Like, I think someone surmised that maybe rats could carry COVID. And then all of a sudden you got like all these news articles that rats are going to give you COVID, yada, yada, yada. So it was kind of nice to be able to speak to like, this is what people are actually experiencing. And these are some of the actual risks associated with this. But then like, don't freak out about rats giving you COVID, but like maybe that urine in your house. Yeah, that's not great. So it was nice to sort of weigh in from an evidence-based perspective.
When you were asking the questions about the hantavirus and leptospirosis, did you in your questionnaire, did you explain to them what it was, or how did you know that they knew what they were responding to?
Yeah, good question. So we were trying to figure out a way to word the question such that we didn't sort of like give it away, but also that we were giving people enough context to even like what are we doing here? So we did explain that all four of these are zoonotic diseases, but like we didn't specify transmission routes or anything like that. So they knew in the context of like, yes, we're not trying to trick you. These are all actual zoonotic diseases, but which ones are actually carried by rats? And so reporting out on that information will be very important, because of course we don't want to leave it at like, well, you didn't know, I guess you'll never learn now. But we are going to visit all of these community groups that we've been working with to actually report out on these results and why we were asking about these specific pathogens and why they're important to know about. So yeah, that's a great point. It can be tricky to balance knowledge questions in terms of giving enough context, but actually asking something meaningful. Yeah.
I think we have a couple questions in the chat.
Has there been any surveillance of rat lungworm in the Chicago area? Any evidence of rodenticide ingestion and higher larvae production in infected rats? Oh, that's a really great question. Not so far, but we do have lung tissue from all our rats that has not been analyzed yet. So that would be really interesting to look at. One thing we are going to use some of the lung tissue for is we just got another grant to look at emergent viruses in the rats. So we're using some of the lung tissue to look at things like coronaviruses, hantaviruses, influenza A, things like that. But maybe we could see the other lung for lungworm. That would be very cool. Sorry, not that you necessarily need to look in the rat lungs, but we have tissue is what I'm trying to say. And how do you adjust the results from your survey with the number of people who have submitted answers? Yeah, Westside had less answers, but more contact. Could there be a bias on who answered? Absolutely, there could be a bias in who answered. I would imagine that I try very carefully to not imply that, like, because, I don't know, 75% of survey respondents saw rats, that 75% of Chicagoans saw rats. Because yeah, I could absolutely see if you've never seen a rat, you do not care about rats. You do not take this rat survey. Absolutely. But in terms of correcting for different sample sizes in different areas, this is sort of like a first pass at our results. We're definitely going to be doing more sophisticated sort of like weighted analyses in the future based on where we are getting results. And we're also going to get more fine scale because, again, with the survey we did in 2021, we asked again for their closest intersection. And if they were comfortable, they could give us their mailing address. So we can look at more fine scale predictors of these things rather than relying on sort of the side of the city that they live in. Okay. Do you communicate results from this project with city policymakers? Is there a plan to advocate for changes that rebuild public trust in the system for rat complaints? Yeah, great question. So we meet semi-regularly with the Department of Streets and Sanitation in Chicago. And so we also provide, policy recommendations intermittently in terms of reports on our project results. Uptake is tricky. And I don't mean to like dunk on the city or anything. I'm not envious of people who have to run like a rat management bureau. But some results are sort of trickier than others, right? I think they will be very interested in our results about West Side communities not feeling like their results or that their complaints are taken seriously, because they have already approached us about such issues where they look at a map of rat complaints across the city. They say, wow, there's so many more complaints in the north side, but we don't think that actually reflects where people are experiencing rat issues. And we notice this gap in the west side. So they're already sort of aware that there might be this mismatch in who is complaining. But I think actually assigning, more of a mechanism to that and sort of a way into those community groups, I think they'll be excited to see that like, yes, our suspicions are correct, that people don't feel comfortable complaining or they don't feel like they're being taken seriously. How can we address this? So then they can actually take that and design communication strategies based on that very specific thing. And then, yeah, sort of plan to advocate for changes. Just as I mentioned, I think now that we know a little bit more specifically that people don't think their complaints are taken seriously, that can help design sort of communication campaigns, sort of maybe showing people like what happens after you complain. We've, in the interviews that I didn't really get into in this talk, quite a number of people had positive things to say, that they complained about the rats. The city came out like 5 days later and baited, and that was great. So using sort of those anecdotes, we can sort of strengthen the case that, the city does try to respond to complaints in a timely manner, and they need to demonstrate that they will do that in all communities, but maybe just give them another chance to demonstrate that. Might be one way to go about that. With the prevalence of rats living alongside humans as civilizations have developed, so they're likely to be with us for the long term, totally agree. has there been any work on treating rat populations for zoonotic diseases to reduce spread? Oh, that's a good question. Sort of like maybe like an oral vaccine or something. Not that I know of. In terms of like new technologies, I know that there is now commercially available sort of birth control for rat populations, like an oral solution. I'm personally a little bit skeptical just because like that's very expensive. They need repeated exposure for it to work. There's a lot of like things that have to fall in place for this to actually work. But as far as I know, I don't know of any actual municipal work targeted at the infection itself rather than just rat abundance. Usually it's just about like getting rid of the rats physically. I will say that there has been other work in Vancouver. There's a great rat project in Vancouver. And they've also found that rats were more likely to have higher prevalence of leptospira after a culling event. And so the idea was that by going in and trapping and removing, you're sort of like promoting population mixing and sort of novel contacts between rats. So that in combination with our rat poison results sort of indicates that like, ooh, we don't really have a good handle on what we're doing to rat populations when we go in and remove a chunk of the population at a time. So yeah, there's a lot of work to be done on like how rodent control impacts disease dynamics for sure.
Any other questions? I know, I realize we're right at 1 o'clock.
These were really great questions, by the way. Thank you for asking them.
Well, thank you so much. This was really an excellent presentation. Very much an eye opener for us, which is awesome. We like to learn new things. So thank you again for joining us, and thanks to everybody who joined online. That's I really appreciate you. Please know and spread the word for those who could not be here that we've recorded this, so we're going to post it on our website. And again, go to our website for all the upcoming events as well.
Well, thank you. It was my pleasure to be here today. And thanks so much for inviting me again. It was great to meet you all.
Thanks.
Thanks. Bye.
And bye-bye.